My name's Dominic Sandilands. I'm Chief Executive Officer for Corryong Health. We're looking for GPs. GPs are the most important member of the Australian health system. In Corryong, it takes a whole nother role. The GP is not just the coordinator of care, they're also the trusted person in the community who people rely on. I'm keen to demystify some of the myths about being a GP in a small town. Specifically, that working in a small town as a GP means that you're on call 24/7. That is not the case. You would be joining an organisation which already has 3 very experienced GPs, colleagues, people who will challenge your thinking to help your learning and growth, but also, and more importantly, provide you with work-life balance. We have a tremendous nursing workforce that wraps around our GP service, practice nurses who are very experienced. We have a full reception staff. We also have a broad allied health team, including an ultrasonographer and a radiologist, as well as support for any GP coming in. We welcome applications from any GP who's looking at something different, something rewarding, and really returning to the values that are important to anybody: family, lifestyle. It is a great opportunity to grow, to develop, where you can experience world-class cycling, which is my own personal passion, but also experience views like you never thought were possible in a place like Australia.
So I'm Nick Mason, I'm one of the GPs in Corryong. And so a normal day, look, we'd see our patients on the ward, a small acute ward with about 8 beds on it, and usually that's just sort of low acuity type patients. Usually there's 3 full-time GPs here, and we share general practice role down here in the clinic, and we also share the cover of the hospital patients and also the nursing home patients. Got a remote on-call service at the moment, which has been a big benefit to us. The work role is a really enjoyable one. It's diverse. We do a lot of procedural, minor procedural stuff that I find really interesting. There's the acute and emergency stuff that we deal with that also is a good diversion from everyday sort of general practice. It's very easy to provide that high level of care that's sort of patient-centred because of how well we know the patients, I guess. My wife, Hannah, came here as a registrar, so we share the one role between us as husband and wife. It's certainly been a big factor in us being able to sort of balance work and home and a big family. There's definitely a fantastic work-life balance living in a town like Corryong. I think it's a great place for kids because it's a very outdoor sort of lifestyle. I do find the Upper Murray particularly beautiful. I love the outdoors. I love camping and bushwalking, but I especially love fishing. It's just a stunning environment. You can access sort of remote, untouched sort of wilderness creeks and waterways that no one else is fishing up here, and so from my perspective, that's great. Look, I think probably the thing that is most enjoyable about working up here is just that the community is such a nice community to be working for. I guess one thing that we found moving here, and one thing that we would like to think will still be the case, is that it's a very supportive team of GPs, and we're very happy to help anyone ease into sort of this type of practice with as much support as they'd need if that was necessary.